Welcome to Mile High Living. I'm Sam Boyk. Thanks for joining us and happy Leap Day. In 2009, the first family-owned and operated American Vein and Vascular Clinic opened in Pueblo, and now 15 years later, they are Colorado's largest network of vein and vascular clinics. Their vein specialists perform the very latest therapies to remedy vein disease, and today their founder, Dr. Gordon Gibbs, is here. It's great to have you.
Thank you. Good morning.
Yes, well, celebrating 15 years. Congratulations on that.
Thank you so much. Appreciate it.
Yes, what inspired you to get the company started?
Yeah, so one of the things that we treat pretty commonly are people with varicose veins, which is an extremely common problem. So it's estimated that about 50% of women by the age of 50 and 25% of men by the age of 50 will have some kind of either varicose veins or symptoms related to it. So it's literally millions of Americans have this problem. So, and the treatments for it are way better than they used to be. And so you apply a real common problem with a much better treatment. And so we recognized that there was probably a need for dedicated centers that would specifically treat this. And so that's really how we got started.
That's so wonderful. And now family owned and operated. So what does that mean for your patients?
Well, we're independent of any of the bigger hospital systems, which allows us to basically design things in a way that's very patient-centered. And so we want people to have a great experience when they come in. We want them to be comfortable. Frankly, we want them to feel like they're in the right place for their care. And being family owned and operated, being small but actually a little bit big now, allows us the flexibility and gives us the tools to create that environment for our patients. That's
really great. And what type of services do you provide for folks out there?
Yeah, so most of what we do is treating people with lower extremity vein-related problems. And so which can be varicose veins, it can be swelling, it can be just general discomfort in the legs, it can be cramping or restlessness at nighttime. Those are some of the common things that we see. And so there are a variety of tools that we have to treat those in the office setting, so outside of the hospital, that are basically just done under local anesthesia in a very quick, convenient environment for them.
Great. And is there anything that you would think that really sets you apart from others out there?
Well, I think, this is what we do.
Okay.
So treating venous disease, vascular disease, that is all we do every day. And so I feel like that's our sweet spot. That's what we're good at. And so I feel like that alone is probably a differentiator. And then creating that environment where it's just very patient-centric, where we want people to know that they're in the right place for their care, is probably another thing that sets us apart from a typical healthcare setting.
Yeah, and what are some of the common symptoms of vein disease that some of your patients may be experiencing?
Yeah, so I mentioned some of the discomfort. Generally, it's going to be discomfort, pain, heaviness, cramping, more so towards the end of the day rather than first thing in the morning. Often it's symptoms that are relieved with elevation of the legs, because a lot of the discomfort comes from just congestion in the circulation. It's like blood pooling in your feet or lower part of your legs. And so those are some of the common things we see. But we also see people with simple spider veins that are asymptomatic. We see people with skin changes where the skin becomes darker and much kind of thicker in texture, all the way up to people who have sores in their legs related to poor circulation where it's just not healing. It's called a non-healing ulcer.
Okay, and is there a type of exam or a type of process to help determine if someone does have a vein disease?
Yep. So a lot of our patients know it before they come in, and so they'll tell us, look, this is what's going on. But what we do to design a treatment plan for somebody is typically use an ultrasound. So an ultrasound is a machine that we can apply a little probe on the leg. There's no needles or anything like that. And we can look at, across the skin and see what the circulation's doing underneath the skin. So we can identify veins, we can identify arteries, we can identify other structures. And with that ultrasound, we can determine which of those are healthy and normal and which ones are abnormal. And from that information, we can design a custom treatment plan for people that's designed around getting their symptoms taken care of.
Okay. And can you remind us what types of insurance that you accept?
Yeah, we try and accept just about any insurance. So Medicare, Medicaid, Kaiser, a lot of the commercial insurances, Blue Cross, United, Cigna, those are all insurances that we cover. So pretty much all the major ones, and even the minor ones, we try and get in network with everybody so that we can, basically care for more people.
Yeah, that's a big help to a lot of patients out there. You mentioned this before. Yes, family owned and operated, but you guys have really expanded quite a bit. 3 new locations here in Colorado, right?
We're pretty excited about the 3 new locations. So we have one new one in Lakewood on the St. Anthony's Hospital campus. So brand new, it's open for business. Everything's just sparkly clean and ready to go. We have another clinic up in Loveland, basically at the intersection of I-25 and Highway 34, which connects Loveland to Greeley. Again, brand new, open for business. And then the third location is in Thornton on the north side of Denver. And that one's a little bit of a unique location because not only can we treat venous disease there, but we can also treat arterial disease there. So which is a little bit of a different disease spectrum. And so if somebody has a blockage in an artery, now we can treat that outside the hospital in an environment that's, again, hopefully very comfortable and convenient for the patient, but also much more cost effective.
Yeah, providing a lot of great services for folks out there that need it. Thank you so much, Doctor. We appreciate you being here.
It's my pleasure. Thank you.
Yes. And love your legs again. American Vein and Vascular Institute offers minimally invasive in-office treatment options for venous disease. Call their number today, 8445-MY-LEGS. That's 844-569-5347. Or visit them at americanvein.com for more information. They paid for today's segment.